Hello and welcome to the fourth episode in our series on depression. In this episode, we talk about alternative therapies for treatment, mainly focusing on electroconvulsive therapy or ECT for depression. Come, let us meet our expert.
So ECT is a short form for a treatment procedure referred to as electroconvulsive therapy. This procedure is done under general anesthesia, which means that the patient would be administered intravenous medicines which will make the patient unaware of the treatment procedure. The treatment involves passing of small electric currents through the brain, administered through electrodes which are placed on either side or one side of the head. This will stimulate the brain and cause a brief seizure, which will lead to positive changes in brain chemicals, leading to rapid improvement in depressive symptoms in about 1 to 2 weeks. This is in contrast to the medications, which might take anywhere from 3 to 12 weeks for their action. ECT was introduced as a treatment for depression in the 1930s. During the early days, high doses of electrical current was administered without general anesthesia or without the use of muscle relaxants. This led to various side effects such as severe memory loss, bone fractures, or other serious medical complications. This has led to a lot of stigma being attached to the use of ECTs. ECTs currently are administered under general anesthesia with the use of muscle relaxants, and therefore it is a much safer procedure nowadays. However, in a given individual, there may be certain side effects associated with ECTs such as prolonged confusion, headache, body ache or nausea following the ECTs, memory problems which might last for a few weeks to up to few months, or rarely medical complications involving the heart and lungs. ECT is typically required for treatment of more severe forms of depression. This would include individuals with high suicidal tendencies, individuals with a condition referred to as catatonia, which refers to immobility and difficulties with speech, or individuals whose depression has not responded to standard treatment with medications. ECTs may also be preferred for pregnant ladies with depression in whom use of medications might cause harm to the developing baby. ECTs may also be preferred in elderly individuals who may be unable to tolerate the various side effects of medications used for treatment of depression. ECT is a safe procedure. However, prior to referring a patient for ECTs, the psychiatrist does a detailed medical history of the patient to look for any potential risk factors for administration of ECTs. The psychiatrist would also do a detailed physical examination and a psychiatric evaluation, and also carry out certain laboratory investigations and ECG. These would be discussed with the concerned specialists as required. The psychiatrist would then explain the risks and benefits of giving ECTs to the patient and the caregiver and obtain an informed consent. Prior to receiving ECTs, the patient is instructed to remain fasting for at least 6 hours.
This concludes the episode on electroconvulsive therapy or ECT as an alternative therapy for depression. We learned about ECT, its side effects and applications and the precautions that need to be taken while administering ECT. We'll be back with the next episode. Namaste.